Welcome back to Market Headlines. The government has prepared several strategies in implementing new normal. There are several industries which are estimated to continue growing and become pillars of economic growth of the new normal. One of them is healthcare industry.
The Indonesian government has prepared several strategies in implementing new normal. There are several industries which are estimated to continue growing and become pillars of economic growth in the new normal. The assistant team of the coordinating minister for the economy, Raden Pardede, say that prospective and leading industries to support the national economy are agriculture, manufacturing, hospitals, and medicines and medical devices. Specifically, the healthcare industry such as hospitals is one of the prospective industries based by government's estimation. COVID-19 pandemic made the government aware to improve the quality of the national health system and no longer dependent on the health system of other countries. The government noted that foreign exchange out of Indonesia in the health sector reached around 75 trillion up to 100 trillion rupiah per year. It's because there are many Indonesians who seek treatment abroad, with the main destinations to Malaysia and Singapore. Therefore, the government is required to be able to build the independence of the health industry, including the supply of medical devices and pharmaceutical needs. From all sources, IDX Channel.
As the COVID-19 pandemic continues, the Indonesian health industry faces a number of challenges. So what is the actual conditions of Indonesia's health industry and its performance in the midst of pandemic? Let's look at the following series of graphics. Here it is. Firstly, I will overview the Indonesian's healthcare providers and the data we taken from the Ministry of Health by the end of 2019. So here it is. We can see three indicators in here. There is a public health center, special hospital, and also public hospital. Let's take a look at the first indicator as it's stated for public health center. So in 2018, the units of public health center only hit at 9,993, almost 10,000, but however in 2019 there was a development since the number grew up to be 10,134 units. And let's take a look at the second indicator, which is special hospital. In 2018, the number was 544, but however in 2019, the number went down to be 533. And moving on to the public hospital, in 2018, the number is in the number of 2,269 units only, but in 2019 the number went up to be 2,344 units of public hospital. From a total of 2,300 hospitals in Indonesia, the government through the Ministry of Health stated that there are currently 800 COVID-19 referral hospitals spread out throughout Indonesia. One thing is, the availability of a COVID-19 referral hospital must be also supported by the central and local governments in terms of fulfilling health services, including human resources, facility, and infrastructure, as well as other medical devices. In the same time, to handle COVID-19 cases in Indonesia, the ability of Indonesia's laboratories also increased dramatically from one laboratory to 220 reference laboratoriums. As the front guard in handling COVID-19 pandemic, the government has provided incentives or stimulus for the healthcare industry. To get a clearer information, let's move on to the next graphic, shall we? Here it is. Through the next graphic, we can see how a government bears stimulus for the healthcare industry amid the pandemics. And the data we take is from Ministry of Finance since June 19, 2020. So here it is. The total realizations hit 1.27 trillion rupiah, and it was diverse into three categories. First of all, incentives for central health workers, as many as 58.25 billion rupiah. And moving on to the second one is that for physical special allocations funds in health by 768.9 billion rupiah. And moving on to the third classifications, added claims for handling COVID-19 patients as much as 451.22 billion rupiah. And the Ministry of Finance has allocated funds to handle the coronavirus outbreak in the health sector as much as 87.55 trillion rupiah. The fund will be used for additional stimulus spending, tax incentives, as well as funds for the COVID-19 Handling Accelerations Task Force. And meanwhile, related to the incentives for the health workers, by June 9th in 2020, the realizations for the incentives for health workers has been given to 11,500 people. These incentives for the health workers are divided into several categories. For a specialist doctor, a maximum of 15 million rupiah per month. General practitioners or a dentist, a maximum of 10 million per month. Nurses for a maximum 7.5 million rupiah per month. And also other health workers, maximum 5 million rupiah per month. Not only incentive for health workers, the government said that the total payment claims for handling COVID-19 patients has also been disbursed into 704 hospitals. And due to a number of incentives and challenges, how is actually the performance of the hospital-based company in the midst of pandemic? Let's take a look in the next graphic. Here it is. We got 3 examples of the bright performance of the healthcare providers in Indonesia, and we've taken the data based on the first quarter of 2020 statements. So here it is. We can see the first example is Mitra Keluarga, the healthcare provider based on Jakarta. The revenue reached by 874.7 billion rupiah. So it means that it has an increase by 8.71% as in a year-on-year. And for the net profit grew by 8.62% year-on-year to be a total of 198.77 billion rupiah. And let's take a look at Saluran hospitals. The revenue of this healthcare provider hit 1.88 trillion, brilliant, with an increase by 9.94% year-on-year, and the net profit jumped by 386% year-on-year to be 16.2 billion rupiah. And moving on to the third example, it is Rumah Sakit Hermina or Hermina Hospital that posted significant revenue, that posted a net revenue that increased by 9.1% year-on-year, and also posted 983.9 billion net revenue, and also not to mention about the net profit that hit by 71.84 billion, that increased by 27.24% as it in year-on-year. And the performance was quite encouraging, although it must be noted that in the first quarter performance ended in March, while in the same time it was the beginning of COVID-19 pandemic in Indonesia. So the impact of the pandemic was not very visible on the company's performance. Despite brilliant performance in the first quarter, weakening performance is estimated to begin in the second quarter. This estimation is based on a sharp decline in the number of COVID-19 patients, and which is caused by people's fears of going to a hospital in the midst of pandemic. The Indonesian's Private Hospital Associations estimates that a decrease in outpatients to reach 50 to 60%, while for inpatients to drop by 40 to 60%, and of course it affects the hospital cash flow. Despite the decreasing number of the patient visits to the hospital, there is a change in society's behavior from those who previously came to the hospital and now can easily consult to the doctors via long-distance connections or even through the telemedicine applications. To know more about it, let's check it to the next graphic. Here it is, the next graphic. We can see the rising momentum of the telemedicine, and we got statements from several international institutions. First of all, from World Health Organizations. Organizations stated that 58% of the 155 surveyed countries have used telemedicine. And the next one is from Department of Health and Human Services based on United States of America that stated that the discretion for the telehealth care through the communications apps such as FaceTime or even Skype. And the next one is from the NHS, which is a national health service based on the United Kingdom, stated that 1.2 million daily face-to-face primary care consultations were done remotely in the past few weeks. And not only in US and UK, doctors in rural and regional Australia are even urging the federal government to continue the telehealth or telemedicine scheme started under of COVID-19, saying it will help the close in Australia's healthy gap. Many patients embrace their telemedicine in the bid to avoid the travel and time required to attend a clinic. And how about Indonesia? Indonesia's government, through the Ministry of Health, cooperates with the British government in the field of health technology, especially telemedicine. Minister of Health, Terawan Putranto, stated that regarding telemedicine, Indonesia's government wants to learn how the UK applies telemedicine so that later the government can improve access in the public health services. And to know more about the facts, let's see it through the next graphic. Here it is. We bring the facts about the most popular telemedicine apps in Indonesia. So we picked 5 out of many popular telemedicine in Indonesia. First of all, it is Click Doctor, and we got Allo Doctor and also Halodoc, and not to mention about Good Doctor and also Sehatku. And as many people have switched to use telemedicine applications to conduct health consultations, CEO of Halodoc, Jonata Sudata, confirmed that the telemedicine service increased dramatically by 600% during the large-scale social restrictions, especially in the consultation sectors and also the doctors and also the drug delivery. Even Halodoc has prepared for more than 22,000 doctors in its ecosystem as a form of alert to the surge in visits. Meanwhile, the other telemedicine applications, Allo Doctor also claims an increase in the number of apps downloads and user interactions, especially on the online consultations feature. And we hope that the pandemic will end soon and the national health industry, including hospital company and telemedicine operators, will be able to make a greater contributions to the country and also the society. Stay tuned to market headlines because we will be right back after this break.